A 60-year-old male presents with a persistent cough, weight loss, night sweats, and hemoptysis. He has a 30-year smoking history. A chest X-ray reveals a mass in the upper lobe of the right lung. What is the most likely diagnosis? Correct answer is B. Squamous cell lung cancer. Pulmonary tuberculosis can present with similar symptoms, but is more commonly associated with positive sputum cultures. Chronic bronchitis typically presents with a chronic cough and sputum production, but not with a mass seen here. Pneumonia would likely cause fever and more acute presentation rather than weight loss and hemoptysis associated with lung cancer. Think you spot this in real life? Subscribe for more.